Welcome to the deep dive. Today we're immersing ourselves in the world of the Turkish Angora cat. Really elegant creatures, aren't they?
Oh, absolutely. They come from Turkey, known for just striking looks, graceful movements.
And they have this great mix of being affectionate, but also really playful.
Right. And they often have long lives, which is, a wonderful bonus for their families.
Definitely something to celebrate.
Yeah.
But, as with any breed, there's the other side of the coin, potential health challenges.
Exactly. And that's what we're going to delve into today. Beneath that beautiful surface, there can be certain risks.
Yeah. So for this deep dive, we've looked at veterinary websites, breed associations, even data from pet insurance companies,
A pretty broad range of sources.
trying to get a clear picture of the potential health risks Turkish Angoras might face. They seem generally hardy, but yeah, predispositions exist.
And often with a genetic basis, which is important.
Crucial. And this isn't about, scaring anyone.
Not at all. It's about knowledge. Understanding these possibilities helps you be a better advocate for your cat.
Right. Working with your vet, thinking about proactive care.
Because early awareness, early management,
Mm-hmm.
it can make a huge difference to their well-being, even if you can't always prevent the condition itself.
Okay, so where do we start? One thing that comes up pretty consistently, especially with those beautiful white Angoras, the ones with blue eyes, is deafness.
Yes, hereditary deafness. It's definitely a notable concern, and that link to the white coat and blue eyes is, it's quite strong.
How does that work genetically?
It involves something called the W gene. That's the gene for the dominant white coat. But it does more than just affect fur color.
Mm-hmm.
It can interfere with melanin production.
Melanin. That's pigment, right? What's that got to do with hearing?
Well, you're right, it's pigment. But melanin is also crucial for the inner ear to develop and function properly. There are these cells, melanoblasts. They need to migrate to the inner ear during development. They basically create the right chemical environment for the hair cells, the sound detectors to work.
I see.
And the W gene can mess up that migration or the function of those melanoblasts.
So disrupt the melanin, disrupt the hearing development? Is that the idea?
That's the connection, yeah. And the statistics really bear this out. If you have an all-white cat with 2 blue eyes,
Yes.
the chance of deafness is really high, somewhere between 65 and 85%.
Wow, 65 to 85%. That's significant.
It really is. Something to seriously consider if you're drawn to that specific look.
So if you bring home that gorgeous white blue-eyed kitten, there's a very real chance they might have hearing loss. What if it's just one blue eye? The odd-eyed cats.
That's interesting, too. In those white cats with one blue eye and one, say, green or amber eye, the risk is still there. Around 40% of them are deaf.
40%.
And often it's the ear on the same side as the blue eye that's affected.
Really? So it can be that specific, like localized to one side?
It often seems to be, yes. It's
Ah.
quite fascinating how it manifests.
Okay, what about a white Angora, but with, say, green eyes or gold eyes? No blue at all. Are they safe then?
Not entirely out of the woods, no. Even in white cats without blue eyes, the rate of deafness is still higher than in colored cats. It's somewhere in the 17 to 22% range.
So the white coat itself is a factor, even without the blue eyes, though blue eyes increase the risk dramatically.
Exactly. The W gene seems to be the primary driver here.
All right, so if an owner thinks, maybe my Angora isn't hearing so well, how do they find out for sure?
The best diagnostic tool is the BAE test. Stands for Brainstem Auditory Evoked Response.
Bay-Ear test.
Okay. Think of it like checking the electrical signals from the ear to the brain. It's non-invasive. It measures brain activity in response to clicks or tones.
And that tells you definitively.
It tells us objectively if the cat can hear, and whether it's just one ear unilateral deafness or both ears bilateral, it's very accurate.
And if the diagnosis is hereditary deafness, what then? Can anything be done?
Unfortunately, no. There's currently no cure for this type of deafness. The damage to the sensory cells or their failure to develop, it's permanent.
That's tough news. But I imagine they can still live happy lives.
Oh, absolutely. Cats are incredibly adaptable. Deaf cats can thrive, especially indoors where it's safer.
So what adjustments do owners need to make?
Well, the main thing is not to startle them. They can't hear you coming up behind them.
Right. Makes sense.
So instead of calling them, use visual cues, hand signals, maybe flicking the lights, or vibrations. A gentle stomp on the floor can get their attention.
Vibrations interesting.
And touch, of course.
Yeah.
Also, just be aware they might meow louder than hearing cats.
Why is that?
They can't regulate their own volume because they can't hear themselves.
Ah, okay. Those are really helpful practical tips. And what about breeders? What can they do to reduce this risk?
The key recommendation is to avoid breeding white cats to white cats. Breeding a white cat to a colored cat significantly reduces the chance of deaf kittens.
So responsible breeding practices are critical here.
Hugely important, yes. Potential owners need to understand that the stunning white coat, especially with blue eyes, carries this increased likelihood of a special need.
Good point. Okay, let's shift from ears to the heart. Hypertrophic cardiomyopathy, or HCM. Our research flagged this as another big one for Turkish Angoras. Sounds serious.
It is, unfortunately. HCM is actually the most common heart disease diagnosed in cats overall, not just Angoras.
The most common? Wow. What actually happens in HCM?
Basically, the heart muscle starts to thicken abnormally, mostly the left ventricle, the main pumping chamber.
It gets thicker.
Right. And when it thickens, the chamber itself gets smaller and the muscle becomes stiffer. It can't relax properly to fill with blood, and it struggles to pump blood out effectively.
So the heart has to work much harder.
Exactly. It becomes inefficient.
And is this thought to be inherited in Turkish Angoras?
Yes, it's believed to have a hereditary component in Angoras, like in several other breeds, but it's also just really common in cats. Generally, maybe up to 1 in 7 cats are affected.
1 in 7. So even without a specific breed risk, it's something all cat owners should know about.
Definitely. And with Angoras, there's that potential inherited link adding to the concern.
What signs might an owner see? How would they know?
That's the tricky part. Early on, HCM can be completely silent. No symptoms at all.
Oh.
But as it progresses, you might start seeing things like difficulty breathing, maybe rapid or open mouth breathing.
Okay.
Sometimes vomiting, loss of appetite, acting weak, especially in the back legs. Lethargy, maybe coughing.
Weakness in the back legs. Why there?
That can be a sign of a blood clot, unfortunately. A complication called FATE, feline aortic thromboembolism. A clot forms in the heart, travels down the aorta, and often lodges where it splits to the back legs, cutting off blood flow. It's an emergency.
That sounds terrifying. Other signs?
In severe cases, you might notice pale or bluish gums or bluish nail beds or foot pads. That's poor oxygenation. Abnormal heart rhythms, collapse, or even, tragically, sudden death can occur.
Gosh, so how do vets diagnose it, especially if it can be silent early on?
Often the first clue is a vet hearing a heart murmur or a gallop rhythm during a regular checkup.
But a murmur doesn't automatically mean HCM, right?
Correct. It's an indicator that something needs further investigation. The gold standard for diagnosing HCM is an echocardiogram.
An ultrasound of the heart.
Exactly. It lets the cardiologist or vet actually see the heart muscle, measure its thickness, see how well it's contracting and relaxing.
What about genetic tests for HCM and Angoras? Are those available?
Genetic tests exist for HCM mutations in breeds like Maine Coons and Ragdolls. For Turkish Angoras, well, the situation is a bit less clear-cut. Specific tests might be available, but their widespread use or validation specifically for Angoras might vary. It's definitely something to discuss in detail with your vet.
Okay, so the echo is key. Any other tests?
Yeah, they might also do an ECG to check the heart's electrical rhythm, chest x-rays to look for fluid buildup or heart enlargement, and blood tests. Sometimes a thyroid test, too, because hyperthyroidism can cause heart changes that mimic HCM.
Right, ruling out other causes. So if the diagnosis is HCM, what's the treatment? Is there a cure?
Sadly, no cure. Treatment focuses on managing symptoms, trying to slow the disease progression, and preventing those dangerous complications like heart failure or blood clots.
What does that involve? Medication?
Usually, yes. Medications like beta blockers or calcium channel blockers can help the heart muscle relax better.
Yeah.
Diuretics might be used if there's congestive heart failure fluid in the lungs.
Okay.
And blood thinners like clopidogrel are often crucial to reduce the risk of those devastating clots. Sometimes ACE inhibitors are used too. It's really tailored to the individual cat.
So it's about managing the condition long term.
Yes, it's about improving quality of life and trying to extend it.
What's the prognosis like for a cat with HCM?
It's highly variable. Really depends on how thick the heart muscle is, if complications develop, and how the cat responds to medication.
So some can live quite a while.
Some cats with mild HCM managed well can live for years with good quality of life. Others, especially if they develop congestive heart failure or throw a clot, sadly have a much shorter outlook.
It sounds like regular monitoring is key.
Absolutely critical. Regular vet visits, echocardiograms to track changes. Sometimes owners are even taught to monitor the cat's resting breathing rate at home if it starts increasing. That can be an early sign of heart failure developing.
That's good information.
Mm-hmm.
And again, responsible breeding comes into play here.
Yes, breeders screening their breeding cats for HCM is so important to try and reduce how common it is in the breed.
Definitely. Okay, moving on. Another condition mentioned is hereditary ataxia. Neurological, right? Affects coordination.
That's right. Hereditary ataxia is a neurological disorder. It affects movement, gait, coordination, and it usually shows up very early, often right around birth or shortly after in affected kittens.
What does it look like?
You'd see signs like stumbling, clumsiness, just a general lack of coordination, maybe a head tilt. Severe cases might not be able to stand properly, or they might have tremors or shaking.
Is this common in Turkish Angoras?
Thankfully, no. It's considered rare in the breed. It's thought to be autosomal recessive, meaning a kitten has to inherit the faulty gene from both parents to actually show the condition. If they only get one copy, they're a carrier, but usually appear normal.
Okay. And what's the outlook for kittens born with this?
Generally, it's quite poor, unfortunately. Many affected kittens don't survive into adulthood, and because it's genetic in origin, treatments like antibiotics or surgery aren't typically effective.
So it's mainly supportive care.
Yes, focusing on keeping the kitten comfortable.
You mentioned ataxia as a symptom, so it could be caused by other things too.
That's a really important point. Ataxia itself just means lack of coordination. It's a sign of an underlying neurological problem. It's not one specific disease.
So what else could cause it?
We group the causes based on what part of the nervous system is affected. Cerebellar ataxia involves the cerebellum, the balance center. Vestibular ataxia relates to the inner ear balance system or brainstem. And sensory ataxia involves the spinal cord, affecting the cat's sense of body position. So, besides this rare hereditary form, ataxia could be caused by infections, head trauma, exposure to toxins. There are other conditions, too, like cerebellar hypoplasia, where the cerebellum doesn't fully develop. Those kittens are wobbly for life, but can often adapt.
So if an owner sees their Angora kitten looking wobbly or uncoordinated,
Get to the vet right away. A thorough neurological exam is the first step.
and then potentially other tests.
Yes, depending on what the exam suggests. Maybe blood work, urine tests, imaging like X-rays, MRI, or CT scans, sometimes even analyzing the spinal fluid. Prompt diagnosis is key because the prognosis can be serious.
Okay, good advice. Let's shift gears again. Something common in older cats generally, chronic kidney disease, or CKD. Is this something Angora owners should be particularly aware of?
CKD is definitely a major issue for aging cats across the board, and yes, some sources suggest Turkish Angoras might have a potential predisposition. It means the kidneys gradually lose function over time.
And they do vital jobs, right?
Correct.
Filtering waste, managing water.
Exactly. So when they decline, it affects the whole body. And the signs can be subtle at first.
Like what? What should people watch for?
Often the very first signs are increased thirst and increased urination.
Drinking more, peeing more. Why is that?
Because the damaged kidneys can't concentrate the urine effectively anymore, so they produce large volumes of dilute urine, and the cat drinks more to compensate and avoid dehydration.
Makes sense. What else?
You might also see gradual weight loss, maybe a decreased appetite, lethargy, vomiting sometimes. The coat might look dull or unkempt, and even bad breath can develop.
That bad breath. Is that from waste buildup?
Yes, buildup of waste products like urea in the blood can cause a sort of ammonia or metallic smell on the breath, sometimes called uremic breath. Any of those signs, especially in a middle-aged or older cat, warrant a vet visit.
So how do vets confirm it's CKD?
It involves blood tests and urine tests. Blood tests look at waste products, BUN, creatinine, and also SDMA, which can sometimes pick up kidney decline earlier than creatinine.
Okay, BUN, creatinine, SDMA.
And a urinalysis is crucial. We look at the urine-specific gravity that tells us how concentrated the urine is. Low specific gravity is a key sign. We also check for protein in the urine, signs of infection, things like that.
Protein shouldn't really be there, right?
Not in significant amounts, no. Protein loss suggests kidney damage. We might do a specific test called a urine protein creatinine ratio, or UPC, to quantify it. And checking blood pressure is also standard, as high blood pressure often goes hand in hand with CKD.
I've heard kidney disease gets staged. What does that mean?
Yes, the IRIS staging system, International Renal Interest Society. It uses mainly the creatinine and SDMA blood levels to classify the CKD from stage 1, which is very early, to stage 4, which is severe kidney failure.
Then that helps guide treatment.
Exactly. It helps the vet understand the severity, tailor the management plan, and give a better idea of the prognosis.
So how is CKD managed? Can you stop it?
You can't stop it or cure it, unfortunately, since the damage is progressive, but you can definitely manage it to slow the progression and maintain a good quality of life.
Diet changes.
Diet is a huge part of it. Special prescription kidney diets are key. They're typically lower in phosphorus and protein, have controlled sodium, and are often supplemented with things like omega-3 fatty acids.
Lower protein. I thought cats needed high protein.
Healthy cats do, but when the kidneys aren't working well, processing the waste products from protein metabolism puts extra strain on them. So reducing protein, while still providing high-quality protein, can help lessen that workload. Controlling phosphorus is also really critical.
Okay. What about medications?
Yes, several might be used. Phosphate binders if the diet alone doesn't control phosphorus levels. Sometimes potassium supplements are needed. Medications to control nausea or stimulate appetite are common, and drugs to manage high blood pressure if that's present.
And hydration. You mentioned they pee a lot.
Hydration is absolutely vital, encouraging water intake using fountains, adding water to food, feeding wet food primarily. In later stages, many owners learn to give subcutaneous fluids under the skin at home.
Sub-Q fluids. Okay. What's the outlook for a cat with CKD?
It really varies. Depends heavily on the stage at diagnosis and how well the cat responds to management. Cats diagnosed early, in stage 1 or 2, with dedicated care, can often live happily for months or even years.
So early detection makes a big difference.
A huge difference. That's why those regular senior wellness checks, including blood and urine tests, are so important.
Makes sense. Okay, our last major risk area to discuss is MDR1 medication sensitivity. That sounds quite specific.
It is, very specific. It's a genetic issue caused by a mutation, a defect in the MDR1 gene, sometimes called the ABCB1 gene.
MDR1 gene, and what does that gene normally do?
It codes for a protein called P-glycoprotein.
P-glycoprotein, okay.
Think of P-glycoprotein as a pump. It sits in cell membranes in various parts of the body, including the blood-brain barrier. Its job is to pump certain drugs and toxins out of cells or out of protected areas like the brain.
So it's like a bouncer, keeping certain drugs away from sensitive areas.
That's a great analogy, yes. It limits how much of certain drugs get absorbed or distributed, especially into the brain. It's a protective mechanism.
So the mutation breaks the pump.
Essentially, yes. The mutated gene produces a non-functional or poorly functioning pump.
And the consequences?
The consequence is that cats with this mutation are much more sensitive to the effects of certain drugs. Drugs that would normally be pumped out can build up to toxic levels, especially in the brain, even at standard doses.
Leading to neurological problems.
Exactly. You can see signs like difficulty breathing, severe incoordination, ataxia, again, dilated pupils, excessive drooling, seizures, tremors, profound lethargy, even coma.
That sounds incredibly dangerous. Are there specific drugs that are known problems?
Yes, there's a list owners and vets absolutely need to be aware of. Several common anti-parasitic drugs are on it. Ivermectin is a classic example, but also selamectin, moxidectin, milbemycin.
Things found in some flea, tick, and worm treatments.
Yes, though often the doses in standard cat preventatives are low enough to be safe even for affected cats, but higher doses or off-label use can be disastrous. And interestingly, recent research highlighted epinomectin, used in some topical treatments. It seems even the standard labeled dose can cause severe, potentially fatal reactions in cats with the MDR1 mutation. That's a relatively new finding and really important.
Wow, that's critical information. What else is on the list?
The tranquilizer escipromazine needs extreme caution. The opioid pain reliever butorphanol, certain antibiotics like erythromycin, some chemotherapy drugs like vincristine and doxorubicin, even the common antidiarrheal drug loperamide Imodium can be dangerous.
Loperamide. People might have that at home.
Exactly. Never give it to a cat without veterinary guidance, especially in Angora, given this potential sensitivity.
This really underscores the danger. Yeah. Is there a way to know if your Turkish Angora has this mutation?
Yes, absolutely. There's a straightforward genetic test available, just a cheek swab or blood sample.
So owners can get their cats tested?
Yes, and it's highly recommended for the breed. Responsible breeders should be testing their breeding cats and avoiding breeding affected individuals.
Once it's inherited.
Yes. So owners should definitely ask breeders about testing. And for any Turkish Angora, knowing their MDR1 status is vital information for their vet before any medications are prescribed or administered.
It sounds like a simple test that could prevent a major crisis.
It really could. It's crucial for owners to have that conversation with their vet.
Absolutely. Okay, so we've covered deafness, HCM, ataxia, CKD, and MDR1 sensitivity. Are there any other, perhaps less common health things Angora owners should just generally keep in mind?
Well, yes, like any cat, they're prone to general feline issues. Dental disease is a big one across the board.
Toothbrushing, professional cleanings.
Definitely important. Obesity is another common problem with significant health risks, so diet and exercise are key.
Right.
Eye issues like progressive retinal atrophy, PRA, can occur, so regular eye exams are wise. Feline lower urinary tract disease, FLETD, things like crystals or cystitis, hydration helps prevent that.
Keep the water flowing.
Exactly. Polycystic kidney disease, PKD, is another genetic kidney issue, though maybe less commonly discussed in Angoras than CKD. Allergies, food, or environmental can pop up, causing skin or tummy issues.
Okay.
And, of course, parasites and infections. The basics of vaccinations and parasite control are always essential. Oh, and one more thing for the white or light-colored ones.
Yes.
Sunburn, especially on the ears and nose if they like sunny window fills or have outdoor access.
Ah, good point. Sun protection for pale kitties.
It all just reinforces the need for good, consistent preventative care and those regular vet checkups.
Absolutely. So, wrapping up, Turkish Angoras, undeniably beautiful, generally healthy cats.
Yes.
But they do have these specific potential health issues that owners really need to be aware of and proactive about managing.
That sums it up perfectly. They're a fantastic breed, and being informed just helps you be the best possible caregiver.
So, final key takeaways for listeners, if they have an Angora or are thinking about one.
Okay, number 1. If you're getting one, seek out a reputable breeder. Ask about health screening, especially for HCM and potentially MDR1.
Crucial.
For current owners, regular vet visits are non-negotiable. Talk to your vet about genetic testing options. Feed a high-quality, balanced diet. Always have fresh water available.
Dental care.
Yes, good dental hygiene. Keep them active, provide mental stimulation. Learn the symptoms we've talked about today. Just be observant.
And for the white blue-eyed ones.
Be extra vigilant about creating a safe indoor space, considering that high likelihood of deafness. And maybe most importantly, communication. Keep that dialogue open with your vet.
Excellent advice. It leads nicely into our final thought for you, the listener. Thinking about everything we've discussed, the unique genetics, the potential predispositions of the Turkish Angora, what further questions does this spark for you? What might you ask your veterinarian about specific preventative care or early detection strategies to help ensure your own feline companion enjoys a long, happy, and healthy life? Something to ponder. Thank you for joining us for this deep dive.